Good afternoon, everyone, and welcome to Mayor Muriel Bowser's Pink Health Festival. Thank you so much for joining us here on the beautiful Audi Field. We have our beautiful new bridge as our backdrop and an important and powerful cause that has us here today. Each year, during the month of October, we bring awareness to an important health issue that impacts so many women across our city every day. Breast cancer is the number one most commonly diagnosed cancer among women in the district. And it's also the second leading cause of cancer deaths in the district. That means that many of you here and many of you all listening to us know someone who has experienced breast cancer. When we look at breast cancer, we can think about it in three different ways. We think about and honor women who have gone before us and have lost their battle with cancer. Today and every day, we honor their legacy and we remember them. And we're remembering them today through our action. Second, we honor those women who have been diagnosed with cancer, the warriors among us who are fighting and need our support. We have with us today some amazing leading experts and champions for our health in the district that have resources to help support you in your fight. We're here with you to support you. And lastly, and today, we are here to reach out and admonish those women who need to be screened for these life-saving services. We want to make sure that you know and that you're reminded to learn about your personal and family history, to get a self-exam, or to do a self-exam, to get screened and to follow up. We have some wonderful community partners with us today, and I want to just give a shout out to the Breast Care for Washington, our memo van and provider for today, Howard University Cancer Center that's here with us, the George Washington University Cancer Center, the Brim Foundation, Capital Breast Care Center, Family and Medical Counseling Services, the Mayor's Office on Latino Affairs, Fit DC, and last but not least, Project Wish and DC Health. Project Wish is working as our DC government and DC Health's lead agency that's helping to bridge barriers for low-income and underinsured women in our district to be able to receive those life-saving services. And we want to make sure we thank our amazing mayor for being a champion and leading those investments that are being critical to women's health. So at this time, I have the honor to introduce our mayor, Mayor Muriel Bowser.
Thank you, Jennifer, and good morning, good afternoon, everyone. I am, of course, happy to be here for the Pink Health Festival to highlight Breast Cancer Awareness Month, a time when we recognize the impact that breast cancer has in our communities and bring awareness to life-saving resources. We're very grateful to our friends here at DC United, the Washington Spirit at the Audi Field for hosting us today and partnering with us. I am also grateful to the hard work that DC Health does every day to support keeping people healthy in Washington, D.C., and making sure that DC residents are taking advantage of the tremendous healthcare resources in our city and staying connected to care. Jen, you've heard from our Office of Women's Policy and its leader, Jennifer Porter. The Commission on Women, of course, takes special notice of how to connect women to care, be it in getting ready or being a healthy woman that is approaching childbirth, but also staying connected to care so that women in the district are maintaining their health. We are grateful to our community partners that have been mentioned, the Breast Care for Washington, Howard University, as well as George Washington University's Cancer Center. We know that the discussion of breast cancer is a national one and also very important here in Washington, D.C., because breast cancer is the number one most diagnosed cancer among D.C. women. We have seen breast cancer mortality rates over time decrease, but there are also significant differences in incident rates by ward. Most notably, women in Ward 8 are about 2 times more likely to die from breast cancer than women in any other ward. And what this highlights is yet another disparity in our healthcare outcomes. We know that we have work to do post-pandemic and during the pandemic, because so many people have not been going to the doctor regularly. First, it was because we couldn't, and then we were scared to be in hospitals and limiting even going to our doctor's offices. So we've missed the regular things that we do, from annual physicals to even vaccinations, and yes, to mammograms. And I hope that our guest is going to talk about people's fear of mammograms, and hopefully we can dispel some of those fears today. So we're very proud to have Project Wish in our community. They make sure that eligible low-income women can get life-saving breast cancer and cervical cancer screenings. We're also grateful to Breast Care for Washington for being here to offer free mammograms. And if you don't need a mammogram today, you may need your woman visit, a physical, or a colonoscopy. I won't even get started on colonoscopies, but we need to stop being scared of those too. At the very least, I'm asking all residents to make sure that you've checked in with your doctor. Let them ask you about your levels of risk. Ask you questions about your family history, which will let the doctor know what screenings you need. And sometimes we put these appointments off. It's become a lot easier to ask your doctors these questions. So many providers have emails and text message systems that you can send messages to so that they can keep track of your health. And obviously, we want to make sure that everyone is getting vaccinated as well. And if it's time for your booster, you need to get your booster too. These are all the things that we can do to keep ourselves healthy, for ourselves, but also for our families and for our community. So with that, please join me in welcoming Angela Warner, who is the CEO and Executive Director of the Breast Care for Washington. Thank you, Angela.
Thank you so much for having us. Honorable Muriel Bowser, the directorships, the management teams that we've worked with in the Executive Office of the Mayor of the District of Columbia, the Mayor's Office on Women's Policy and Initiatives. On behalf of Breast Care for Washington Board of Directors, our co-founder, our dedicated staff, and support network, thank you for the opportunity to come here today and speak and be a part of the first annual Pink Health Festival during such an important month, Breast Cancer Awareness Month. Congratulations for making this happen. You know, we highlight this month for some as a kickoff to getting on track with awareness, education, and for us, that starts with a screening. Yet Breast Cancer for Washington, our stakeholders, our community partners, and health systems, donors, and grant funders, we meet our missions to assist our residents in the district and DMV areas in the area of breast health services every day. As CEO of Breast Care for Washington, I work with an amazing team to bring forward the message that with early diagnosis and prevention in breast health services delivery, we can save lives. The continuum of breast care services should include prevention, screenings, workshops, provision of cancer treatment to include meeting post-treatment needs, survival care, and hospice provided by our value partners in the healthcare space. Yet, within all these stages I just mentioned, equitable access to breast health services eludes many. Consistent with institutional and systematic barriers to care, all too many times this results in increased morbidity and mortality of our patients. We also know at Breast Care for Washington that vulnerable populations who are diagnosed are less likely to have consistent access to facilities for screening and treatment of breast cancer. We were founded in 2012, and the vision of BCW's co-founders was realized in the creation of a breast imaging facility where women receive top-notch care regardless of barriers of income, geography, and insurance status. Breast Care for Washington is community-centered, and our mission is to reduce breast cancer mortality and breast health inequities in the Washington, D.C. area by promoting access to breast cancer screening, diagnostics, and referrals for treatment to all, regardless of their ability to pay. That is our mission, as realized by Dr. Regina Hampton, Breast Care for Washington's co-founder, Chief Medical Officer. Breast Cancer for Washington is located in Ward 8 within Community of Hope, a federally qualified healthcare center, and is currently the only mammography facility in this area to routinely and consistently provide breast care services to the uninsured, the underinsured, and those who have coverage as well. Dr. Regina Hampton, who is our Chief Medical Officer, is also the breast surgeon who performs breast biopsies on site for those patients that have abnormal findings that is consistent with the need for further diagnosis. We also provide patient navigation and financial services in a welcoming environment where women interact with culturally competent staff who are caring and put those fears and anxieties to rest, because we don't want that to be the reason why you stay away and get your breast cancer screening. We also work with Project WISH to enroll residents in a coverage program to improve access to life-saving breast and cancer screenings, cervical. So in 2019, BCW achieved the milestone of having this mobile mammography that you see behind me through a donation of Rad8 International and Hologic, and it features state-of-the-art Hologic Genius 3D technology. The mobile program further our mission by expanding access to breast cancer screenings for all where they live and where they work, areas that are remote, that are rural, and we want to work to reduce the barriers that exist. That includes transportation to healthcare facilities for this breast services. And the Brem Foundation, who's here today, assists us with that mission as well. Between both our main location and mobile mammography program, we have provided care to over 8,000 women and diagnosed over 71 cases of breast cancer. The wards that we serve have one of the nation's highest rates in breast cancer mortality. BCW remains focused on reducing healthcare disparities that have disproportionately impacted our communities of color. We don't want any barrier to impact the decision to seek out breast health services. We don't want you to be afraid. If you feel something, say something. Give us a call, and you will be able to speak to caring staff so that we're able to assess and help you through your healthcare decision making, because with information comes power. In closing, we don't do this alone, and we look to continue to build partners to increase awareness and involvement across different disciplines and sectors, including our health and medical providers, our government agencies, our nonprofit organizations, community-based organizations, local businesses, our cancer survivors, and our advocates. And that's all of you here now. If you want to know more about us or donate to initiatives such as our Day of Giving, which allows us to continue our mission of providing free cancer screenings, please visit our website at www.breastcaredc.org, or you can find us on Facebook, Twitter, Instagram. Our website allows you to contact us directly so that we can call you and make an appointment. And again, thank you for allowing Breast Care for Washington to be a part of this great day for the district. Thank you. Mayor Bowser?
Thank you. Okay, we'll take a few questions and then offer a tour of the van. Any questions?
Yeah, hi, Mayor. This month is Breast Cancer Awareness Month.
Who's speaking? I
Shane
can't
at
see
WTOP.
you. Oh, there
Hi
you are. Okay.
I'm being blocked. That's okay. What's the city doing for the rest of the year to raise awareness of city services, not just this month, Breast Cancer Awareness Month?
We have always are talking about ways that people can connect to care and connect to health, whether healthy lifestyles, whether it's with Fit DC or with a number of our partners who do programs and fairs throughout the year that are supported by our offices, whether it's the Department of Health or our Office of Community Affairs.
And then another question. As you know, there were 2 lawsuits filed against DC police. I know you can't comment on the lawsuits, but the NAACP is calling on you and the police department to review and change policies they say prevent whistleblowers from coming forward to address systemic racism in the department. Any comment on what the NAACP is asking?
No.
Okay, thank you.
Yes.
Mayor Bowser, on breast cancer awareness, and you touched on it a little bit, that people have been unable for whatever reason to get out and do routine medical checkups, whatever they might be, and there's also a reluctance that may be coming as part of COVID. Again, just what would you say to those people who have put off, for whatever reason, routine medical examinations like a mammogram?
Well, one thing I'll say, Mark, and I don't think I'm that different than most people. I look on some of my social media, and I just see too many people my age, 40s and 50s, who are just dropping dead. I mean, who are sick. Some of them related to COVID, some not. And so what I would say is that none of us should take our health for granted. We're living in a time of extreme stress. And all of those things have impacts on the body. But I know also when I talk to medical professionals, they're concerned about people delaying care, the colonoscopy, the mammogram, checking their blood pressure and diabetes, chronic ailments that can really lead to significant outcomes, significantly negative outcomes. So we don't want people to delay. Dr. Nesbitt wouldn't be happy if I also didn't mention we don't want to see pediatric preventable viruses pop back because people haven't gotten their normal childhood vaccines. So all of those things speak to the reluctance or just even catching up that people have to do with their medical providers. Some people may be surprised that many medical providers have changed or pivoted how they're delivering care, and it may be more convenient for you. So check in with your provider. Perhaps you can send an email. Perhaps you can have a video visit just over your phone so that your doctor can touch base with you and give you some recommendations. And then there may be a van that is coming near your neighborhood that will take out the barrier of transportation, and you can go close to home to have the services that you need right in the breast care van.
If I could, a couple of off-topic questions.
Sure.
One, it's been a rough week for Metro riders
Yep.
for a lot of different reasons. Can you just talk about your level of confidence in the general manager and the ability to deliver services and the system itself? Or do you have any concerns other than just the day in, day out service that we're seeing the problems with?
Well, I share the public's frustration, and people may not appreciate about what I'm going to say, but what we've seen this week is a demonstration of how the system should work. If we have a problem, we have a safety commission that's independent of the authority that should look at the information independently and make a decision that is in the best interest of the riding public and the system at large. So I think that's where we are. I know that the inspections are happening at the rate they're supposed to happen, and I'm hopeful that the cars that have been taken out of service for inspection will be back in service very soon. I can't say anything more. I haven't had a substantial enough briefing on how they got to that problem or what led up to it, but we will be paying close attention.
And if I could follow up on you were asked last week about reciprocity for tickets in the district with Maryland and Virginia, and you kind of corrected the record on there. But your office has released data now showing that currently there's almost $500 million in unpaid tickets, most of it by out-of-state drivers, much of it just from Maryland alone. And there is no reciprocity for either way, from Maryland coming into D.C. or D.C. back to Maryland. But you had mentioned last week that you were considering beginning that conversation with the other jurisdictions. Can you update us on just your thoughts on that $500 million figure, and then what could or might you do about reciprocity?
What I also said last week, Mark, is we think everybody should pay what they owe as quickly as possible, and that's the best way to make sure that the system is working. We have rules here. There are speed limit rules, parking rules, and all of them are meant to keep the city safe and everybody who uses our network safe. And not paying makes one part of that enforcement mechanism fail. So payment of fines is an important part of our enforcement mechanism. I also mentioned last week that I think the best way to proceed is through a regional body to make this part of the region's initiatives to stop traffic deaths. We contribute heavily to an education campaign. Now it's time for all of us to sit at the table to have a regional enforcement campaign, and ticket payment is key to that.
My last topic, I'm sure you saw what the mayor of New York City did with requiring all government New York City employees to be vaccinated. Can you just update us on where you are in thinking about either more mandates for vaccines or rolling back the mask mandate? I've been hearing from several business owners who are just kind of wondering how much longer their customers are going to have to continue to wear masks indoors.
Well, because people have so heartily embraced public health measures in the district, we do see our incidence of COVID going down. We are grateful for that. But we also know we're heading into a time of more indoor gathering, be it Halloween, was where we started to see the spikes last year in other fall gatherings and holiday gatherings. So, Mark, all of the business owners and members of the public should know that DC Health is very focused on, providing any relief that we can. While I don't have an update today, I expect that we will be talking about how well our numbers are doing, what our expectations are for the fall, and what remain as needed interventions. You said New York City. What was your question about that?
Just, are you considering following their lead of expanding the mandate for vaccines beyond what you have just now?
Well, we pretty much have a mandate for vaccines. Our next date of that we're focused on is November 1st, involving school personnel and all school personnel being vaccinated. Our systems of tracking that vaccination and for the people who are opting to test instead is evolving. And so we feel pretty good about where the numbers are. It sounds like what New York City has done is to get rid of the testing out option, which is a good thing. And it is something that I think that will be inevitable in D.C., but right now our focus is on our healthcare workers and our school personnel.
Thank you.
Okay, thank you. Let's see the bus.